Hello, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kym Douglas. On today's episode, we're going to talk about your skin. And we have one of the leading experts in the field of dermatology on the show. We're going to find out everything from skin cancer to the best methods for good skin health. With us today is Dr. Delphine Lee, who is the director of the Dermatological Center for Skin Health at Providence St. John's Health Center. Welcome, Dr. Lee, and thank you for being here.
It's a pleasure. Thanks for having me.
Yeah, we're so glad you're here. Well, first tell us, what is dermatology? What is it?
Dermatology is a subspecialty of medicine in which we focus on all matters of the skin, your largest organ.
Yes.
And that actually also includes all of the skin appendages that arise from the skin, including the hair follicle. Part of the hair follicle includes the oil glands, sebaceous glands, right, the sweat glands, and also the hair itself, and also the nails. So any condition that affects those areas.
So good. And we all have that. So we want to get into it. So what are some of the common illnesses that you treat when it comes to hair and nails? And what are the symptoms that we need to look out for?
Well, the most common condition of hair problems is hair loss.
Yeah.
There are so many different causes of hair loss, and the most common is probably just general physiologic patterned hair loss, either male patterned hair loss or female patterned hair loss, which also tends to be hereditary. And then with nails, typically nail findings can be associated with other skin conditions, whether they're rashes that are indicative of immune dysregulation. They can also be involved with vitamin deficiencies, eating disorders, and then, of course, just general common skin ailments that we see in dermatology include acne, psoriasis, skin cancer, a whole host of different things.
Well, how about our skin? Let's talk about some of the illnesses that you treat and what are the symptoms that we need to watch out for.
So when it comes to skin cancer, the most common thing that you want to look for is a changing lesion, a new lesion, perhaps a non-healing wound. There are some specific things to watch out for when worried about melanoma, which is the most deadly skin cancer. And I like to teach patients as well as primary care doctors about a mnemonic, the ABCDEs. So A stands for asymmetry, when a lesion is not symmetric. B is borders, if the borders are irregular. C is color, multiple colors like red, white, and blue, or even changing colors. It was black, now it's become white. And then D is diameter, the end of a pencil eraser, which is 6 millimeters. Something bigger than that should just catch your attention and have you bring it to the attention of your primary care doctor or your board-certified dermatologist. And then the last is E, which is evolving. A lesion that changes, maybe gets smaller, larger, changes in color, like I mentioned before. And any of those criteria would be something to look out for and to bring to the attention of your doctor.
That's so good. And why is early detection? Like you see one of those ABCDE, and then why is early detection important?
So yes, early detection of melanoma is critically important. Melanoma, despite all of the new therapies, which we certainly have had an amazing renaissance with immunotherapy, with our ability to treat melanoma, it still can be deadly at late stages. We lose probably in even 2023, the numbers now are just under 8,000 we predict would die of melanoma, which is about one person an hour. So, we still are losing people to melanoma. And what's amazing is, the thickness of a dime, 1 millimeter, is already too thick of a tumor. So we want to catch these really early. And just the sooner you catch them, the sooner you can remove them and have a decreased chance that it's spread.
The thickness of a dime.
That's right.
Wow. Well, we probably all, if anyone has watched the news, knows that President Biden had a growth removed that was basal cell carcinoma. So what is that? Because I wasn't really sure. And how is that detected and how is it treated?
So basal cell carcinoma, I always tell this to my patients, if I had to pick one of the skin cancers to get, I would pick a basal cell carcinoma. It is a very slow growing tumor. Tends to be one at farther along stages to be a non-healing wound, which is something that I was saying to look out for. It isn't always brown. Melanomas tend to be more often brown. Basal cells tend to be pink. Sometimes they might even start as something that a patient would say, oh yes, this was a pimple, but it never went away. Pimples do not last forever. And then it evolved and it got bigger and then started to develop the center being a little bit of an ulcer or a sore. And the way we treat those is with surgery. They are cut out. And there are some special surgery techniques that dermatologists use called Mohs micrographic surgery, where we take it out one layer at a time. That allows you to know at the end of the surgery that day that it's been cleared.
Mm-hmm. All the margins.
All the margins are clear, and you can go home knowing that there are no residual skin cancer cells in the site.
So are there any other types of skin cancer to be aware of?
So yes, basal cell is the most common. The second would be squamous cell carcinoma. Another one that is usually pink, or sometimes they can emerge from chronic inflammation, a site that has been repeatedly traumatized, or even they can grow out of scars. They tend to be a little bit more aggressive than basal cell carcinoma, and we also treat those typically with surgery and also Mohs surgery if it is on a site that is a cosmetically sensitive area or an area where you can't take really wide margins. So the Mohs surgery technique that I mentioned before, we usually use that on the face or maybe on the back of the hands, or if it's a recurrent tumor.
Mm-hmm. Now, what about rashes or itchy skin? What options are available to help reduce and treat itchy skin?
So there has been a lot of research on itch, and we've learned in the old days we used to just treat itch with antihistamines.
Okay.
Everybody will just take Benadryl, and that sometimes does work. But we've learned now with all of the research in itch that there are many other receptors that convey that feeling of itchiness. And some of the most simple things you can do if you do have itchy skin is to just moisturize, because dry skin itself can cause itch. And when the skin is dry, the stratum corneum, the top layer of skin, which is dead skin cells that have not sloughed off, they have tiny micro tears. And then when patients are itchy, they scratch and those tears get bigger and they irritate those superficial nerves. So just moisturizing and trying to help repair that skin barrier can be really helpful.
Makes so much sense, because in the winter we tend to always be a little bit drier, and
that's right,
you get that itchiness.
Exactly.
So another skin issue that affects mainly teenagers is acne. So let's discuss ways to treat acne and when someone should go see a dermatologist like yourself.
So acne is also multifactorial in what causes it. One of the bacteria that we know plays a role in causing the inflammation in acne is Propionibacterium acnes, renamed actually Cutibacterium. We use antibacterials for that, and an over-the-counter reagent, over-the-counter medication that patients can get is benzoyl peroxide. Okay. So benzoyl peroxide is great. Sometimes can tend to be drying, and some of the prescription formulations may be less drying. So benzoyl peroxide is a great thing to add to your armamentarium, and it's even found in washes that are over-the-counter. Another thing that's important is to help the sloughing of dead skin that tends to clog the pores. And there are many alpha hydroxy acids that you can get over the counter, or salicylic acid that are in acne washes or in acne creams that are helpful to slough off that top layer of skin so that the pores don't get clogged. And then lastly, there are retinoids, which are vitamin A derivatives, very good for acne as well as for aging skin and fine lines. Over-the-counter molecules that people commonly find will be retinol, retinaldehyde, and then there's prescription ones such as tazarotene or tretinoin, and those tend to be a little bit stronger. Yeah. The thing that you have to worry about is with retinoid topical treatments, they can cause a bit of a rash. So it's good to just, if you develop any irritation, good to have a dermatologist kind of follow along and help with some of the things that might mitigate that rash.
Absolutely. Let's move on to prevention, and we should start with sunscreen. So I see people, especially when I'm taking my walks or whatever, and they're slathered with like a white filmy pasty look to it. So why is it so important to wear sunscreen to protect your skin? And does the sun really cause wrinkles?
Oh, that's a great question. Absolutely.
It does.
I'm sorry.
Oh, Dr. Lee.
So there's ultraviolet light, UV, A, B, and C. UVC is the most damaging, but actually never even hits us because it's dissipated by the ozone layer. Okay. But UVB is this ultraviolet light that can actually cause mutations in our DNA. It also causes our skin to turn red, and it gives us a sunburn. And then UVA penetrates the deepest and can actually damage our dermis and destroy the collagen that helps keep our skin plump and wrinkle-free. So the wrinkle-causing ones are UVA. And the thing is, when you go out on a cloudy day, you think you're protected. But UVA goes through the clouds. And UVA goes through the car windows. So we have to wear sunscreen that is broad spectrum, because then we know that it has ingredients that will block both UVA and UVB to prevent the destruction of the dermis and destruction of the collagen, which is the structural protein we need for healthy skin.
Well, I use a sunscreen, tinted, called MD Solar Sciences. And I'll tell you what, I do look for paraben-free and toxin-free, because even with our sunscreens, we have to be careful of all of that, correct?
Yeah, there are some studies that maybe some sunscreens may be harmful to coral, and there are some states now that are banning certain ingredients. As far as toxicities of sunscreen ingredients for, human health, there are some studies, but still not really fully validated yet. So I think we need more research to understand the impact of those.
So what does SPF stand for, and does a stronger SPF mean that it's more effective?
So SPF is sun protective factor, and when a company creates a sunscreen, in order to get the SPF label, they test that sunscreen on a number of individuals, and what they want to look at is how long it takes for that person for their skin to turn red in response to ultraviolet light. Now remember, UVB is the only ultraviolet light that causes you to turn red. So this SPF factor, sun protective factor, is really about UVB. And so let's say it takes you a minute to turn red under a certain dose of ultraviolet B. They then put the sunscreen on and measure how long it takes for the skin to turn red. So if it's 30 times, then it's going to be sun protective factor of 30. If it's 50, it's 50 times, right? So you can think about it that way. The amount of protection or blocking has been estimated for SPF 30 to be about 97, 98%. When you go up to 50 or to 100, you're gaining another couple of percentages. And the thing is, you really need to reapply every 2 hours anyway. So even an SPF 30 is probably fine, but it isn't wrong to go to SPF 50 or 100 either.
So besides the sunscreen then, what are some of the other ways that we can protect our skin and keep it healthy?
So there are other ways to avoid sun and to protect you from ultraviolet light. There are ultraviolet protective factor fabrics.
Oh, yeah.
Right. So you can wear UPF clothing, rash guards, covering up. You go to a dermatology conference and you go to the hotel pool. You know all the dermatologists, they're in the pool with long sleeved shirts and long pants. Those are their swimwear. It looks like long underwear. But they've got the right idea. You're protecting your skin with UPF fabric, seeking shade. Simple things like that, a big broad brimmed hat,
right.
Sunglasses with ultraviolet filters as well is very important. You can get melanoma in the back of the eye because there are pigment producing cells back there. So I always tell my patients, I can't look at the back of your eye when you have your eyes checked. Just remind your ophthalmologist, especially for my melanoma patients.
My mother was a beauty queen 100 years ago. And she used to always wear gloves when she was driving. Mm-hmm. And
great idea.
Yeah. And it sounds like driving gloves, like how weird. But you know what? She had great hands like you. She never had those brown spots.
Well, hands are cosmetically sensitive. And I think people forget that. We wear sunscreen and we put it on our face, but we forget the V-neck and we forget the backs of the hands. And so sometimes that's the more telling place to look.
Absolutely. So are there any creams, lotions, ointments that you would recommend that help to keep our skin looking healthy?
So I would say, aside from anything that has a sunscreen, also there are antioxidants, and there are things with ingredients such as vitamin C. Also, vitamin B3 or niacinamide has actually been proven to help prevent skin cancer, taken as a supplement or put in topicals. You can find that as an ingredient in topical things. There are a lot of other botanical things that might have some benefit, but maybe not as well studied. Green tea extract, also some of the acids, the alpha hydroxy acids I mentioned before. There's also polyhydroxyl acids, beta hydroxy acids like salicylic acid can also be helpful just to help get that top layer of skin to slough off.
Oh, that's all great information. Now let's talk about you. So why did you choose to become a dermatologist?
Oh, dermatology is a great specialty. It combines all the areas of medicine. There's surgery, there's medical dermatology, there's procedural dermatology with lasers, and then also just another side of another hat that I wear is I also do research. And so being able to study the skin, which is readily accessible, and understand how to manipulate the immune system to cure rashes or to help prevent or even treat skin cancer in new ways is just such a great specialty so that we can actually access the disease that we're studying.
Absolutely. And you seem so passionate about it. I really love that. So not only do you treat patients, but you also train future dermatologists. So tell us a little bit about that.
So I'm the program director for the residency training program at Harbor UCLA. And it's a pleasure. It's such an honor to treat, or not to treat, but to teach the residents and to see them come in as first years. And it's a 3-year program, and seeing them graduate at 3 years and how much they've learned, how much they've grown. And it just feels really good to be part of that process to train the next leaders of our specialty and leaders for our community.
Well, speaking of that, what makes St. John's such a special place, not only for you as a doctor, but also all of us as patients?
Oh, well, St. John's, I've been at St. John's now since 2011.
Okay.
And it's not actually, the doctors are very important, but the staff, the types of people that are attracted to work at St. John's, like my assistant, Kishelle, I hear her on the phone talking to a patient, and I can really, it's palpable how much she cares and how much she wants to understand what they're going through, and listens and tries to help them find their answers, just to help them navigate this very complicated healthcare system that we have. The patients, I think, also are just really wonderful people, and it's a pleasure to get to take care of them.
That's beautiful. As we wrap up, we have something on our show called The Takeaway. So I always like for our audience to have a takeaway. So if you had one important piece of information that you wanted our viewers and listeners to remember, what would it be?
It would be to look for new lesions, look for changing lesions, and avoid ultraviolet light because it is a carcinogen. One thing we didn't talk about, but I would mention is, what about my vitamin D? You can take a supplement, because if I told you, smoking is a carcinogen or nicotine is a carcinogen, if I told you, you need to smoke to get your vitamin D, why would you do that, right? So exposing yourself to ultraviolet light is basically exposing yourself to a carcinogen. Wear the sunscreen instead and take a vitamin D supplement.
And wear a hat. Right? I love that.
Absolutely.
Well, that's about all the time that we have, Dr. Lee. Thank you so much for being here. It's been a pleasure, and I could talk to you about skin for hours, literally. Thank you to all of you for joining us, and thanks to St. John's Health Center Foundation and the many friends of the foundation for making this podcast possible. And we also want to thank all of you for joining us today. And if you missed our previous episodes, please visit yourhealthydose.org, where you can see and hear all of them that we've already done. So until next time, I'm Kym Douglas with Your Healthy Dose.